Okay, good afternoon to everyone and good morning to our friends in Nordic countries. We just have finished one of our earlier session with tutorials, which is a smartphone monitoring for jaundice of newborns. Next, now we have actually from Braincare or Sonia, which is a long-term epilepsy monitoring solution. So before I start on that, my name is Nika. Let me share my slides just to show you a bit of information about this program. Okay, so that's what I mentioned earlier. Later at 5 o'clock, we have another company called TypeWave, which is actually a revolutionization of learning of patients. And the structure for today's presentation is 30 minutes of presentation, including demonstration if there's any, followed by 15 minutes of Q&A. So this presentation is scheduled from today up to 15th of June. Please help to share this information with your friends and colleagues. And here are the link to sign up, and it's free. If you are unable to attend the online sessions, but still do sign up, because then we can then have the records to send you the recorded sessions on YouTube. If there are any challenges that you are facing that are not in those that we are sharing throughout these seasons, please send it to me and we'll be on the constant lookout for solutions. Below are my contact, mobile number and email. So there are a total of 17 companies, solutions from the Nordic countries. So, okay, now I'll hand over the time to Katrina. I will stop sharing and then I will allow her to share. Katrina, the time is
Hello,
yours.
I'm going to start sharing my screen. I'm Katrina.
Yeah, go ahead.
There we go. Okay, can everyone see my slides?
Yes.
Or at least someone?
Yeah, good.
Okay, perfect. Good morning or good afternoon in your case. Hi, my name's Katrina and I'm the CEO and founder of Soenia by Braincare. We're a Finnish startup company and we're focusing on digital therapeutics for remote neurological monitoring. And we also have discussions in the psychiatric diseases also. So neurology and psychiatry are our specialties. Our goal is to provide a better quality of life for patients and to enable that by also providing better care for the clinicians to make easier decisions faster. So the problem that we are tackling is that there are many diseases in the neurological family of diseases that require the patients to track down their symptoms. And we started with epilepsy and we've expanded to migraines and headaches and so on, cluster headaches, cluster seizures. And for the clinician to long-term treat these patients, they need medication changes, and for the medication changes to be accurate, the doctor asks the patients to keep a paper diary. And the problem with paper diaries, they're forgotten, they lack motivation, it doesn't show up to the next visit, or it gets filled in the last 2-3 weeks, and it doesn't represent the last 3 months since your previous visit. So this is the main solution, the main problem that we are trying to address. And in some countries around the world, it is illegal for healthcare providers to access email of patients. I'm not aware of Singapore law if that is, but for the European countries, it is. And other problems for neurological patients is medication adherence, and there is a lack of treatment solutions for patients in the rare and difficult to treat populations. So our solution to this problem is to provide a solution that addresses all the diseases in the neurology sector. And we did this because it was easier. In the beginning, we started with only epilepsy, and we found that neurology departments wanted a whole solution to treat a family of diseases that have relating issues for like symptom tracking. So what we have developed is a CE marked and UKCA marked solution. So that's covering two regulatory jurisdictions. And the CE mark and UKCA mark cover unlimited diseases, illnesses, and conditions for symptom monitoring. That means if a patient needs to track a headache, we can track a headache legally. Or if we need to track a migraine seizure with an aura, we can track that too. So the idea is that the patients download the app from Android or iOS. We will be launching a new version. I'll talk to you about that soon. So the patients download the version and then they connect to the clinic. And the clinicians, they're able to log in and view each patient that they need to monitor. And they can monitor the patients on demand, or we can monitor the patients on a need-by-need basis. So we have run clinical trials in Finland, and we have found that the solution has been run actually on adults and on children, so pediatric patients reporting their symptoms. And we have found that the healthcare providers, which means the nurses and the doctors, and primarily the nurses in Finland, because they're the ones that are entering data and interviewing data and handling phone calls and gathering this information. So in Finland, we have found that the adult clinics save around 50% and pediatric clinics save up to 66% of their time on scheduled and unscheduled phone calls. What this does is it changes a 30-minute phone call or 20 to 30-minute phone call into a 10 to 15-minute phone consultation. So you accelerate your phone calls, because when the patient calls, or if you schedule a call with the patient and you need to find out what have been their symptoms for the last 2 months because of a medication change or whatever the need be, the patient, you already jump straight in and you open the solution and you see, okay, you have been reporting simple seizures and you've been reporting complex seizures. We see how much you have reported. So the conversation already skips the interview phase and it goes straight to the problem. Is it a medication issue or something that's complicating things for the patient, which is the basis for the phone call. So we cut the phone call time in half. And we have run the clinical trial in Finland for 48 months. And with the patients that use the system, by them reporting the system, the patients have shown improved medication and treatment adherence compared with the patients who did not use the system. So they had better treatment adherence to what the doctor prescribed for them over a 48-month trajectory instead of the standard pen and paper diary. And this is because patients feel that they're being monitored and taken care of better. And then the other issue at hand is pediatric patients. In Finland, the pediatric patients, when a seizure is happening for an epileptic child, it must be recorded or reported to the clinic. And the idea is to quickly address the clinical needs of the patient or the child as quickly as possible. So we have found savings, and we have noted that in our application. And we had a child case where the nurse, so we have noticed that the pediatric nurses use the system differently than the adult nurses. The pediatric nurses will open and check. They will open to the general screen. Here is just our demo set inside. So they will go and they will review all of their patients, and they will look at, was there any last minute entries for their patients? Something that needs to be addressed immediately. So on the dashboard, the pediatric patients were being reviewed on a daily basis. If something happens, the nurse would follow up and go talk to the doctor, or something is going on. So when we go back to the system, we go to the adult patients. The nurses would just let the system run with the patients filling in their diary, their digital diary on a regular basis. And the idea was that they only opened the records for that patient when either their visit was coming or if there's an unscheduled phone call or a scheduled phone call. So they optimized it on a need-by-need basis, dependent on the patient. So if we walk you through, I will walk you through a little bit the older system, and we are now launching the new system on August 1st. So it will look slightly differently when, if we get to the point where you're interested in trialing our system. So in the older system, we do have a list of recent events. This can be customized to your needs, and we can just change what we want to show. And we have a list of all the patients that can be shown. We can keep track of the information that the patient has entered, and it can also be left as a minimal set, which would be the name and identifier information for the patient. So you at least can know that the patient using the system is your patient. And then for the data itself, this is highly customizable to what you want to see. We have it so that you can scroll through a range, and we will have some default, last month or last year, so that you can see is something going awry and the patient is having problems and that it needs to be addressed. And then we have it also available if this is how you want to see it in a numerical format, where you can say, okay, there was 86 type of absence seizures for the patient, or 47 tonic seizures for this particular patient. And this system, so with this trend in mind, it makes it easier to review. It benefits the doctor and it benefits the nurse. So the doctors also save interview time. So it's having multi-stakeholder benefits. And then we have in a different screen, if a clinician or a nurse wants to add a note about a particular event, it's added to the records, and then your colleagues can see it so that there's something, if something looks different, usually there is no need to add a note, but occasionally there is a need. So this is a ability in the system. And then as for the patient side, this is because it's a medical device in Europe. We have medical compliance for it. So the current release, which is going to also be relaunched with a newer version on August 1st. So what the patient is doing is they have the reverse chronological entry of all their symptoms, and their symptoms can be from any disease. So when a patient needs to report a symptom, they were reporting the symptom that they want to report. And then optional symptoms include the duration, location, activity, and trigger. Duration would be for, like, if it's a migraine patient, you would mark how many hours it was. So you'd say you had a 4-hour headache. Or if you had an epilepsy patient, they would say they had a 15-second seizure. So this is valuable information to the clinician also. And then the location, this is optional, and it would be reported in terms like home, park, shop, school, very generic. So there is no identifiable information in there where the patient really is. It's how they want to identify it. So if something comes up where we have a particular patient that has, let's say, migraine headaches, and they typically are during their working hours, maybe they want to change it so that they take their medication at a different time of day so that they can have their headaches at home and they can still work and have a functional life. And then two other useful pieces of information, because these are usually neurology patients that are using our software, is activity level. And this will say something like they're resting, like sitting on the sofa, or they're doing some moderate sports like walking around the park. And triggers will be something if the patient notices they forgot to eat, like their blood sugar dropped low. So this is in the system, so it's accessible. And then for privacy policy purposes, we have, this is our demo account, but it'll show that it's connected to your hospital so that the patient knows that only the data is being shared with your hospital and no one else. So in the next release that's coming in August, we will have a list of diseases, and this will pre-map to the symptoms that are typically associated with this particular disease. So for the list of migraine patients will have a select list of things like headache, sensitivity to light, tiredness, and so on. And these and everything in this, what we see on the screen, it will be translatable into, at the moment we have an English, Finnish, German, and Swedish. And if we eventually want to go farther and get a pilot, then we can organize the needed languages in Singapore. But I understand English is quite common. So if a patient clicks 2 of these boxes, it will show all the possible diseases that are, all the possible symptoms that are for these diseases that they pre-select. And then the patient can pre-choose which types of symptoms they typically report. So then it makes it easy for when they're filling the ad screen, it's only showing the relevant symptoms that they need. So we have done this in a way to maximize the number of, maximize the number of patients using the system as long as possible. And the way we have done that is we have made it as few clicks as possible so that the patient, we are targeting the needs of the either overly busy patient or so-called lazy patient that's not motivated to document themselves. The highly motivated patients will fill the form completely every single time. But we have to also address the patients who are barely interested in just reporting minimal information. So we have done that, and we have shown the clinical adherence for, it wasn't quite 100%. We did have some patients move away out of the system, but it was very high number that went all the way through 48 months of reporting. And then we kept adding to the system in the original clinical trial. If you compare this to other software solutions out on the market, typical dropout rate is in the first 1 to 3 months. Patients get upset that the app is asking too many questions, and then they will stop reporting, and then the system is a waste of your time. So it's valuable to you and us that we keep the patients satisfied and make it as easy as possible for them to report. And now we're trying to add this so they can report multiple diseases at a time and not one disease. So this way, if a patient has 2 comorbidities, or let's say 2 diagnostics assigned to them, then you can watch them for migraines and cluster headaches, for instance. So that way, if you need another disease added, we can pre-add a list of symptoms, and we map it to the disease itself. And so then that patient will have option to monitor those symptoms. And I know in the coming release, we have done it in a way that your clinic can overview what the symptoms are as the definition for each disease. So if you want to add 1 or 2 new symptoms or delete 1 or 2 from the list, your clinic can have a customized what are the symptoms reported. So this is the overview of us. We are doing other things. If you want an extra 1 minute of our time, I will just show you that our core disease is epilepsy, and we are developing an implant. And our disease, our app will communicate in the future also for patients who will get an implant. And this is for monitoring the most serious and most severe epilepsy patients that need chronic monitoring for years. The app is available for every patient. It is for the simplest disease, such as headaches. And what it is it's a tool for the patient to report their perspective on how they're feeling at any moment in time. And it will help the clinician make a better diagnosis and provide them the information they need. So I'll just leave it on this slide. And if you have any questions, I'll be happy to start Q&A already now. And thank you for your time.
Thank you, Katrina. So now we are into the Q&A session. Any questions from the floor, or you can also type it into the chat. So if you have any question, you can just unmute yourself.
If something comes into the chat, could you read it for me? Because I do not have that.
Yes,
open.
I'll read it out. Yeah. Generally, I think they will just send to everyone, so everyone will get to see it. So maybe I start with one simple question. Katrina, you mentioned about customization just now. I didn't quite get it. Do you mean that actually the hospital or the nurses or the IT folks within the hospital can do the customization, as in if we choose to actually remove some of the symptoms or remove some of the diseases, can we actually have the control on our own? Or we have to come back to you for a customized version?
In this current release that's starting August 1st, I'm 100% confident that we can modify it for you. I am not yet certain if the admin role will be active yet, where you can start modifying yourself. That one, so in the long term, for sure, you will be able to do self-customization. But if we are thinking for discussing for September and perhaps starting a pilot in October, November, I cannot say if the hospital self-customization module will be already ready. So if they want to start and it's not ready, we will offer our full hands-on support, and I will communicate with whomever needs to adjust the list to make sure. What we have done is we have made inside of the clinician screen, the new release has already a drop box and a button to push that says request for support or request for improvement. So if you need to tweak something, you just click the button, type what you need or want, and then it also goes to us and we can read about it, and then we will contact for a meeting or clarification if it's not clear what's to be done. The idea is not really to take away too many symptoms, but it's more so that we can easily add and make sure that the symptoms are really there if we need to add something, or if we need to refine something, because we will have to run this also through a translator. So if we do have some translation flaws, we will definitely fix everything there. So basically everything is customizable with the cloud. How we are rebuilding this new release, it's highly flexible.
Thank you. Any questions from the floor?
If I'm to ask the listeners and the audience, what is the most important way that they would think about using our system? Would they be more interested in just checking the dashboard for any high alerts on demand and then go look at that patient? Or would they just only open the system when they're about to sit down and have a phone call or a visit with the patient?
Anybody from the hospital that would like to answer that? Okay, we have a question from Manfred. Hi, is this limited to neuro patients only? Is the company working on other medical conditions for remote monitoring?
It's possible we can do that. We can do other diseases. We just kept our focus because of let's say, the overlapping footprint of the reporting a symptom. But if there is a disease that's outside of neurology where you want to report a symptom for a patient, that's doable. We just need the list of symptoms and triggers and a modification, and it would already fit into our CE and UKCA mark, the way we did our paperwork. So regulatory compliance would be in place, at least for those jurisdictions. But yes, we can add it for another disease. We just had been focusing on these, so it's doable.
Yeah, I think just to add on to this question, I think the question derived because locally our nurses actually do quite close follow-up with patients who are discharged from the hospitals. So that is actually quite a time-consuming task for many of the nurses. And sometimes when you call the patient at home, they might not be at home or they're not able to pick up. Then again, there's a lot of time wasted. So if there's such an app just to make sure that maybe after operation, they are discharged, know that their condition are stable, there's no pain or their medication issue. I think that's quite a good follow-up. But my question would be, since that this is a CE certified clinical software, but when there are so many changes, does it mean every time you have to go back for CE certification, or actually it's not necessary?
No, not in our case, because the footprint of the software is basically the same. And with a few feature added, it's us updating our paperwork inside our QMS. So we don't have to redefine the CE mark or do, unless we do some major radical changes that are to the whole system. But what we are doing here is adding just new diseases, which are it's just types of information, and the way we have tested it and the reporting system has the compliance still holds with the regulatory. The one thing that we can do that we would run a pilot on and we would document it just to have a clinical report. If there is a questionnaire that needs to be pushed to a patient or patients, then we can plan a question and the time it's driven to the patient. That is not yet, but that will be a coming module that we will add. And that way I would want to have it documented with the clinical report and to show that it's useful. So then we add that to our body of evidence. So if that's an interest where at least I'm aware that like you have a quality of life survey type question for certain diseases, like if you're looking for like sudden death and epilepsy or again, quality of life. If you need something, a question just pushed through the app and then you want it added to the system, this can be done. But that won't be ready August 1st. That will take a bit more time for that feature coming. And that feature, we would want to run a clinical report on it, and we would sign it, and we would even pre-draft it for you so that it comes that and that's how we help the clinical reports we have available on our website. We would use that as a template format. We would update it, pre-fill it, and then we would ask the clinic if this is really valuable to them, just edit it as they see fit, and then sign it when they're happy with the information in the clinical. So we can already pre-fill clinical reports for them. And there's a benefit to doing this. It enables future purchase for the clinic to say, here we have documented proof that this system was useful to us, and here's why, and it's on paper. So that if the nurses want something, then they can get it and they have it on paper showing their benefits. And we can help them document it because we've already done this with adult and pediatric. So we have already template reports that can help them document their benefits they will have if they run a pilot with us. Is there something more that someone has? I don't know, it can be technical questions and I will do my best to answer those. It can be clinical questions.
Yeah, Katrina, there's another question, follow-up question
Yes.
from Manfred. Say thank you. How would this Braincare how is this Braincare unique from other companies providing remote monitoring services? Can the platform be linked vital information from wearables? How have your current user adapted the information from the app to their EMR? EMR is in electronic medical records.
Okay, so the way we operate is we recommend hospitals to start as standalone, and then they decide, they run it for a while, and if they like it, then they can choose to integrate it to the EMR if this is of an interest. And we know that's a longer process and it's a lot of IT work for the hospital also, and that's why we recommend start standalone first. Second reason, yes, the field is very competitive. And I go back to what I said, I will go one slide back. Many of our competitors, they do have apps, but the way they gather information, it usually frustrates the patient and then they stop using the system in 1 to 3 months. So then the system is useless. So that's the absolute most important thing, is what we are good at, is making a system that makes it simple and easy, few clicks, and the order we ask the information, it makes it so that the patient will want to keep using the system. And then because software is software, it's, well, technically everyone can make software. The reason why I showed you as a hint of what we're doing is we are making in the background, and this is why we start and focus with the neurology sector, is we are developing an under the skin EEG implant for multi-years of measurement. So this is highly focused. It's backed with patents. This cannot be copied. There are other companies attempting to measure EEG in the long run. They do not have software components. They do not have an app. So we have a unique offering, and this makes our software far more valuable than any other software, because most software that doesn't have a linked sensor of interest it's much harder for them to go and map much farther. Other things that we are doing in the background that might be of interest is we are working with setting up contracts to work with pharmaceutical companies to analyze anonymous data, to make sure that when we're analyzing the drugs that go with the patients, then we will be able to add and identify when a patient uses a certain drug, their expected or average response is a certain number or a certain range. And so it will help the healthcare provider if a patient is operating out of the normal range for a certain drug, then usually that's time to either change the drug or investigate with the patient what's wrong or what's not happening. Did they just forget their medication regularly or something? So there are other things we're doing in the background that are making our system more unique than our competitors. And a lot of it is due to the implant we're doing in the background. So this is the software system for the nurses and the patients is it adds to our portfolio of what we're doing for neurology. And this is a simple tool that we can do and offer and customize for hospitals to cater to the needs of the hospitals. Oh, and then integrating other sensors, this is possible. If there is an interest for certain sensors, my request would be that it's either CE marked sensor or something that's a medical grade sensor. I would give priority to those, because otherwise we need to map it in the system what is a medical grade wearable versus a non-medical grade wearable.
Thank you. Any other questions? Okay, you still have more questions after this session, you can always email to me, and then I can follow up with Katrina to get the answer for you. Katrina, probably I will start sharing my screen as well.
Okay, it sounds like then what? Thank you for our time, and thank you for all the questions. And we will send some follow-up slides to you so that they can be shared, if I understand.
Yep.
Okay.
Yeah, you can send your slides to me. And anyway, these sessions are being recorded, so
okay,
we will actually share it with those who have missed it. Let me just,
let's move my
sorry,
face.
I stop your sharing. So you can share your slides again. Yeah.
Yes, you can email me at katrina@soinia.com. Or you can handle the questions and send them to me, and I will also answer.
They can send to me as well, then I can follow up and
okay.
collate the questions to you. Okay, so we just finished our Q&A session. So you, as what Katrina has mentioned, you have more questions, or you want to have, I think she mentioned a couple of times, to have pilots to work with Braincare, then you can actually send the information to me. I will then link you up with Katrina and also the Business Finland office. So if you need to see some demonstration or whatever, you can always send to us as well. So this is my email address. And tomorrow, following that, we have 3 more companies coming in to share their solution as well. But today at 5 p.m. with another company called Tideway, which is a bed turning solution. So if you have no questions, that's all from us. Thank you for attending. So we'll see you again, hopefully at 5 p.m. today. Thank you. Bye.